Varicose veins is one of the leading conditions and it requires proper management. Dr. Mohal Banker has performed 12,000 plus procedures for varicose veins, and also he is one to start 𝙀𝙬 embolization for the first time in Western India. I would like to call him on dais and share his knowledge.
Thank you, Isha, for nice introduction. So, what is the magical formula for varicose vein? This is a brief introduction of our hospital. Bankers Vascular Hospital has done more than 12,000 procedures for varicose vein, and is the first one to start these venous 𝙂𝙬 embolization treatment and many more other new advanced treatment into the Western India. So, as the time change, the treatment changes, and most of the time, the treatment is suitable into that era. Like if you see the old movies, and at that time we like that movies, but if after 10 years or 15 years, if we see that same movie, then we just remember that how was the boring movies it was. So similarly, the treatment changes as per more and more research and data, more and more research on the disease and more data available. Each treatment is based according to the timing. The ultimate goal is to make the super hit Bollywood movie. Similarly, ultimate goal of the treatment is to destroy, to take care of the main reason for the disease. And for varicose vein, the treatment goal is to destroy the venous intima. So first one, it was started with the ligation stripping, then come the foam sclerotherapy, then come the laser ablation, and then come the RF ablation, and ultimately right now the glue therapy is most advanced treatment for the varicose vein. So now each treatment has some disadvantage, and that's why more and more research occur and try to eliminate the negative point from the previous treatment. So in the ligation stripping, there's a high recurrence and high blood loss. There's a risk of anesthesia. Then come the foam sclerotherapy, which has replaced the ligation stripping, but it is not effective for junctional incompetence because there's a high recurrence rate. Then come the laser and radio frequency ablation. It has too much post-operative pain due to thermal energy. When we are doing the laser and RF ablation, temperature goes up to more than 120 degrees Celsius into the RF and 600 degrees Celsius into the laser. These are intraluminal temperature, and that's why there is a lots of perivenous thermal injury, and it leads to the pain into the first 5 to 10 post-operative days. But then come these venous 𝙂𝙬 embolization, which has eliminated all these negative points for the previous treatment option. So how it works? So these really magic for the patient because we do the single needle puncture, then place this glue catheter near the junction, and everything is done under the USG guidance. And after the placing this catheter, we inject the glue. And whenever we inject the glue, these glue come into contact with the blood and it will polymerize, and it will simultaneously we give the compression from the outer side. So the two wall of this reflux vein will be stick together and the reflux will be eliminated. So this will seal the lumen, and once we treat some portion of the lumen, then we retract the catheter and we deliver the glue into the another part. Like that, we treat the entire lumen of the GS wing. So advantage, there is no post-operative pain, no bruising, return to normal activity much faster than any other modality, and no post-operative stocking required. And this Bollywood actress Taapsee Pannu has already gone through this venous 𝙂𝙬 embolization for the varicose vein, and she has revealed on her Instagram page. And most importantly, she has done this before the Rashmi Rocket movie, and in Rashmi Rocket movie, she plays the intensive role of athlete. So after doing this varicose vein with the venous 𝙂𝙬, she has done lots of athletic work also. So let's see what our patient says.
મારું નામ નીરજ નાનાવટી છે અને મેં ડોક્ટર મોહલ બેંકરના ત્યાં લેટેસ્ટ વિનાશિલ ટેકનોલોજીથી અમારું વેરિકોઝ વેઇનનું સર્જરી કરેલ છે અને આ ટેકનોલોજીમાં મને સૌથી બેનિફિટ કે મારું સર્જરી થયું કે પછી મને ખબર જ ના પડી કે સર્જરી થઈ ગયું. જે દિવસથી મારા રૂટીન વર્કમાં લાગી ગયો, કોઈ સ્ટોકિંગ્સ કે કશું જ પહેરવાનું નથી હોતું અને 1 મહિનો ઉપર થઈ ગયું મને, તો મને કોઈ તકલીફ છે નહીં. પ્લસ મને 4 થી 5 દિવસનો નવરાત્રીનો ટાઈમ હતો અને ગરબા રમવાનો શોખ હતો, તો સાહેબે મને એ પણ છૂટ આપી હતી કે તમે રમી શકો ને હું સારી રીતે રમી શક્યો. એટલે મને એવું લાગે છે કે આ ટેકનોલોજી સૌથી સારી છે, જે બધાએ કરાવવી જોઈએ, અને પ્રિકોશનલી જેને શરૂઆત હોય તો એને વહેલા કરાવી.
So these are all the patient says for this technique, and in conclusive remark, Vinasil wins the trophy of best treatment option available in the current era, with superiority in patient's comfort, less recurrence, no post-procedure stocking, and early resume to day-to-day activity. Thank you so much.